Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. Sorry if there is any mistake in videos or shorts. Today's topic or question is dental home. Mainly asked question in short note for both undergrads and masters, and one of the important topics or questions in a pediatric dentistry. First, you have to make an index including headings and subheadings followed by the references, must for the students doing masters. Dental home and home both are different topics, so please read carefully during the exam. Coming to the dental home. In 1992, American Academy of Pediatrics proposed the definition of medical home, and in 1999, Novak described the term dental home. Then APD in 2008 and 2009 gave the definition of dental home. The dental home is an ongoing relationship between the dentist and the patient, inclusive of all aspects of the oral health care delivered in a comprehensive, continuously accessible, coordinated and family-centered way. Comprehensive in a sense that it includes all the requirement one need, which are continuously accessible, coordinated, and make sure the family is in center. So it is very easy to remember. These are basically the characteristics you can see here. So you can remember it vice versa. Only the two characteristics, which is compassionate and culturally competent, are the extra. So it is very easy to remember. So the dental home is an ongoing relationship between the dentist and the patient, inclusive of all aspects of the oral healthcare delivered in a comprehensive, continuously accessible, coordinated and a family-centered way. The establishment should not later than 12 months of age, because it is an investment in your child's overall health and well-being. So this is a crucial step in ensuring optimal oral health throughout a child's life. Coming to the characteristics of the dental home, you can also remember it by the order given in the definition, followed by this compassionate and the culturally competent. So starting with the comprehensive, so these are basically the characteristic: comprehensive, description and the practical advantages. So comprehensive means it include every type of treatment or the care one requires. So it include preventive, primary, tertiary care provided, and it is also 24 hours a day and 7 days a week. So the advantage is any emergency access is ensured, and care manager and primary care dentist are in the same place, because it's include everything. The second is continuous. So same primary care provider from infancy through the adolescence, and assistant provided with the transition. So the advantage is that throughout the same provider, they know the child from infancy to adolescence and the child's need. So they better know where to recall and how important the recall visit is. So appropriate recall intervals are based on the child's need, and continuity of care is better owing to recall system versus episodic care, and coordination of complex dental treatment is possible, and also the liaison with the medical providers for the children with the special healthcare need is improved, because liaison means the bridge between the two parties. So they become the bridge between the medical providers and the patient. So that's why that's very easy. Coming to the accessible. So this care provided in the child's community, and all insurance accepted, and the changes in the coverage accommodated, means the insurance companies are flexible to change their policy due to some specific needs of the policy holder. So source of care is close to the home, accessible to family, and minimal hassle encountered with the payment, because insurance policies are ready to change their policy due to some requirements. Office ready for the treatment in emergency situation because of the accessibility. Then office is non-biased in dealing with the children with the special healthcare needs, and dentist knows community needs and resources also. Then coming to the coordinated. So family linked to support, education and community services, information centralized. They coordinated in each way possible, in a way of support, in a way of education, in a way of community services. So information centralized means the data, information and resources are collected, stored and managed in a single central location, and due to that the advantage is record centralized. Means they have a provider, so that a system or process has been put in a same place to connect individual in a need of anything with the appropriate providers. So they provide the school, workshop, therapy linkage is established and known. Coming to the family centered, so recognition of the centeredness of the family. They understand that the family is the main core. They give them unbiased, complete information, and due to this, the low parent-child anxiety, which improves the care. Care protocols are comfortable to the family because they put a family in a center. Appropriate role of parents in home care is also established. Now coming to the compassionate, they expressed and demonstrate concern for the child and family, and due to that the advantage is that the child dentist relationship is established, family relationship is established, and the children are less anxious because they feel the familiarity with the healthcare provider. Then the culturally competent, cultural background recognized, valued and respected. Due to this, the mechanism is established for the communication for ongoing care. Specialized resources are known and proven if needed, and staff may speak other languages because they know the value of the cultural background and also know that dental terminology. Coming to the advantages of dental home, it embraces the importance of early interventions with the optimal preventive strategies chooses based on the risk of the patient. They encourage the first dental visit by approximately 1 year of age. Practitioners can provide personalized preventive approaches for the children based on their family history, oral examination, and the risk factors which are identified. And these risk factors include the medical history, dietary habits, medications, fluoride availability, and parental attitudes. The AAPD's recommendation for periodic preventive care provide a framework for the practitioner to consider when the developing of his policies and the recommendation. And the important feature of the dental home is to provide anticipatory guidance. Basically, anticipatory guidance has its own question, own short note, and also own long note. So the anticipatory guidance is basically an information and advice about the child's oral health and the developmental stages. Preventive intervention can be personalized to the needs of the child. Now you have to also mention the specialized care referral. They also need to refer the child to the other specialized one in some situations. So when a child has been observed over a period, appropriate recommendations can be made for the other treatments such as orthodontic referral and observation. So in some conditions they have to refer them to the orthodontist. Recognize changes in a growth and development. They can be discussed with the parents as well as make appropriate recommendation to seek further consultations from the child physician. So they need some clarity with child physician. So they also have to refer to the child physician. The continuous care provided by a dental team also would recognize other developmental milestones. They may suggest needed attention. In a dental home, the office can track the sequencing of preventive interventions. For example, the timing of the placement of the dental sealants on a permanent first molars can be anticipated from previous appointments and scheduled appropriately. Behavioral research support a child's increased level of comfort and reduce anxiety level as familiarity increases with the dental environment. And the dental home can provide personalized and individualized recall program for the child. These are the references. As always, you have to mention must if you are doing masters. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Thursday evening 6 p.m. and Sunday morning 11 a.m. Also, we try to put MCQs according to the topics every day or alternate day on our shorts with the answers and explanation if needed, which will help you in Viva or NEET exam. Like, share and subscribe the channel. Thank you.